So another really important topic to discuss about Bellafill, and really fillers in general, is how much do you use? Do you use 1 syringe, 2 syringes, 20 syringes? It can be confusing because, first of all, the answer varies on who you are, what your face looks like, but also where you're trying to correct and what you're trying to achieve. If someone comes in with a very specific concern about a nasolabial fold or a single line around their mouth, we might just use 1 filler of any type. But if we're talking about really a more comprehensive rejuvenation, where we're trying to lift the cheeks and give the effect of a mid-facelift, then a person's going to need a lot more than just 1 syringe. A person may need 5, 6, even more syringes. Now, in those cases, I don't always put it all in at once because that can be a bit overwhelming, so I'll kind of stage it. But the idea is, in these areas, we want to provide a gradual lift, which means putting very small amounts over a wide area, which can take up quite a few syringes, 2, 3 syringes per side. Now, that again leads to the advantages of Bellafill. If I was using 2 or 3 syringes of any other filler that was going to disappear in a year, that's not a great financial decision, nor is it great in terms of having to go through that process over and over, meaning it gets both costly and time consuming in terms of recovery time if it's something you're going to have to do repeatedly. But when we use Bellafill, we're getting many years of results in those areas, so it makes it much more value oriented to try to get that correction that'll last for the long term.